More than 95% of cervical cancer is due to the human papillomavirus. I'm Susanna Lawrence, family nurse practitioner, Women's Health Medical Director here at the West Texas VA.
And I'm Amanda Pinkley, the Women Veterans Program Manager at the West Texas VA. We're here to educate you today a little bit on cervical cancer. January is Cervical Cancer Awareness Month.
Cervical cancer is a cancer that starts in the cervix. The cervix is located at the bottom of the uterus. It acts as a gateway in pregnancy and it helps hold the baby in place. Primary cause of cervical cancer is HPV, or known as the human papillomavirus. In very rare cases, less than 5% are not related to HPV. The human papillomavirus is the most common sexually transmitted infection in the United States. It is most commonly spread during vaginal or anal intercourse. If contracted, most women will clear the disease on their own. A handful of women may not clear the virus, which continues to produce the HPV positive result when tested. Over time, this causes the cervical cells to become increasingly abnormal. In a small group of women, this cervical cell evolution will ultimately form a cancer.
So let's talk a little bit about prevention. Early detection is key. This is why we promote and recommend Pap smears, which can include HPV testing. These allow your provider to test for HPV in abnormal or precancerous cells. So when is it required? After age 21, at a minimum, anyone with a cervix should contact their provider and make sure they're getting preventative screenings, known as the Pap smear, at least every 3 years. That would continue up through age 29. Once we cross the age threshold from 30 and above all the way to 65, the spacing of those tests may span even as far out as every 5 years, depending on the testing the provider does. Your testing could be closer together dependent on the results of your test if there's abnormal cells or things that we want to really follow up on and keep an eye on. So if we're starting at age 21, it would come to make sense that if you're under 21, Pap smears are not recommended routinely. And if you're over 65, they're typically not done routinely either. There's always some gray area and some ifs, ands, or buts there as well. So you want to make sure and talk to your provider. Additionally, if you have had a hysterectomy with the cervix removed, you may not require Pap smears either, but the cause or the reason for that hysterectomy comes into play as well. If you had a hysterectomy for cancerous reasons, you still may require vaginal swabs periodically over time. And those recommendations are for average risk patients. The recommendations can always evolve if your risk level is higher or if any testing comes back abnormal or questionable. So who is at risk of cervical cancer? Well, it's anyone who has a cervix, regardless of gender identification or gender identity. Risks do increase if you smoke, if you're immunosuppressed, such as with HIV, organ transplants, or on any type of therapies or medications that can reduce the body's immune response, and also if you've had a history of abnormal Pap smears in the past, especially if you didn't follow up. So another question we get is if you can get HPV if you're not sexually active. Unfortunately, lack of current sexual activity may not 100% eliminate the risk of HPV. This is due to the risk of having HPV exposure in past encounters that you're unaware of, or the potential for future exposure, possibly due to unwanted sexual encounters. This can still expose you to HPV, and HPV can cause cervical cancer. Unfortunate statistics are that 1 in 4 young girls or women are sexually assaulted in their lifetime, and 1 in 5 women are sexually assaulted in the U.S. annually. So why is cervical cancer so dangerous? Well, you could be developing cancer or precancerous cells right now and not even know it. If you think about it, you cannot see your cervix. If you've ever tried to reach it, it's very difficult, so you can't feel it. And the only way to really detect the abnormal cells that cause cancer is via a Pap smear or routine screening with your provider. The majority of cancer in the cervix doesn't produce any signs or symptoms, so your body may not give you any clues that this is going on. If you do have signs or symptoms, they might include bleeding after sex, painful sex, especially if that pain is new, a sensation of pelvic fullness or pain, or increased vaginal discharge.
This is why we stress the importance to you to follow up with your primary care provider or OBGYN. For veterans, you can contact your PAC team or your community care OBGYN. Treatments of cervical cancer depends on the stage of discovery. There are 3 stages of treatment for pre-cancer, early stage cancer, and more advanced cancer. In pre-cancer or dysplasia, it can be treated in an in-office procedure by your OBGYN. Early stage cancer is generally curable. It usually includes surgery, which possibly could include more aggressive surgery. More advanced cancer is harder to cure and is treated with a combination of chemotherapy and radiation.
So, why do people still get cervical cancer if we know that there are preventative methods? Well, one is that maybe they've had an inability to get routine screenings, such as the pap smears and HPV tests. The second is that they did not get an HPV vaccine. So, this means your prevention measures should include having those routine screenings that do include pap smears and HPV testing when appropriate, talking to your provider about the option of the HPV vaccine for yourself and your children as well, both male or female. As a note, HPV vaccines are 99% effective against HPV, and if you recall, 95% of cervical cancers are caused by HPV. Receiving the vaccines and getting routine screenings gives us a great opportunity to prevent this cancer all the way. As a reminder, routine screening should start at age 21 and can go all the way up to 65 and beyond. Routine screenings, which include HPV tests as appropriate and pap smears, should be done on anyone who still has a cervix, regardless of gender identity.
Again, I'm Susanna Lawrence, family nurse practitioner, Women's Health Medical Director here at the West Texas VA.
And I'm Amanda Pinkley, the Women Veteran Program Manager for West Texas VA, and we are both located on the Big Spring campus. If you would like to know more about cervical cancer or preventative screenings for women, you can contact myself or those in my service at 432-268-5071 or make an appointment to speak with your provider.